Hospital-acquired infections are a real concern, particularly with 100,000 deaths per year from them. And they're especially a problem with antibiotic-resistant infections that are common in the intensive care units. So, a study was done showing that intensive care unit hospital workers who wore disposable gowns and gloves when entering each patient's room also washed their hands more often when leaving those rooms, and the reduction in the methicillin resistant staph infections was notable. So, how do they do the study?
Yeah, this was an interesting study. Actually, this study was done and published in the Journal of the American Medical Association in October of 2013. And what they did is they took about 20 ICUs across 15 different states that amounted to 92,000 cultures and about 26,000 patients over 9 months in the year 2012. And these were done by researchers from the University of Maryland and from Yale University Medical Centers. And so when they did this study, it was kind of surprising that if they wore a gown and gloves, on all patients that were in the ICU, as opposed to just what the CDC says, Vicki, then there was a marked drop in the number of methicillin-resistant staph infections. In fact, it was about 40%. So this is a big deal and a big change.
Well, what are the current CDC guidelines for wearing gowns in the intensive care unit?
Well, basically, there, all they say is that if someone has an infection, that you should wear a gown and gloves to prevent or if you're even carrying the microbe. So say you're carrying methicillin-resistant staph infection inside of your nose or it's somewhere in your sputum, then they would say you should wear gloves and a mask.
So do you think that this should be universally adopted so that they wear gowns and gloves in all the patients' rooms?
Yeah, I do. I mean, if you see 40% fewer infections from MRSA, that's a big deal. But what they did find that's kind of interesting is that vancomycin-resistant enterococci, which is another kind of microbe that runs through ICUs and through hospitals, had no difference. So it's interesting that it works for some and it doesn't work for others, but it still is going to save lives.
You know, the hand washing thing is kind of interesting. Remember that study that we did a video on about how the hospital care workers wash their hands more often when there was a video? Well, kind of like, duh, of course they're going to.
Well, there's a big liability there. I mean, the liability, if you're spreading infection from one patient to another, is a big deal because you could be sued. And if you're on video, you're not going to let that happen. And that's what happened to these hospital workers.
Well, let's talk about some other solutions. There might be some other more practical solutions, like we did a video once on copper.
Mm-hmm. Well, this is very interesting because copper kills microbes within about a minute and a half. And it lowers the risk of infection by about 97% in ICUs. So you're looking at something that makes perfect sense. And where would you put this? You'd go to those places in the ICU where people are handling things a lot, like telephones and bed rails and doorknobs and
light switches.
Lights, all kinds of things like that. And it wouldn't cost all that much to take care of it.
That would be another good place.
Oh, I think we could work that out. Yeah, that's for sure.
The thing that's really neat about the copper is that it doesn't just kill bacteria and the MRSA, it also kills C. diff, which is also an antibiotic-resistant bacteria. And it also kills funguses and viruses, like the flu, for example.
Sure.
I mean, this seems like a great solution. And, you know, it's not when you talk,
expensive.
Well, yeah, that's what I was thinking about, like all these disposable gowns and gloves and so forth. They might complain and say, well...
That would be nothing compared to spreading an infection. I mean, you have somebody in the hospital for a month with a MRSA or some other kind of infection. They may be there for weeks to months, and that's looking at hundreds of thousands of dollars. It would even cover the expense of the copper that you could put in all these surfaces in ICU beds or bedrooms where it would solve a problem that's huge here.
So let's talk about also maybe some other things that could be done, like boosting the patient's immunity. How can we do that?
Well, boosting immunity is a big deal. And what we can do is we can use things like probiotics. I think it would be very smart to use the friendly bacteria that don't cause disease, that help protect us from colonization inside of our bodies. We could use L-glutamine, which is a powerful amino acid that keeps the intestinal tract strong and the immune system that resides there. Then there's better nutrition and vitamin D. A lot of just common sense things.
But the thing is that a lot of patients that are in ICU, they really can't swallow and eat things because they're on tubes and IVs
Right.
and everything else. So how would they get the probiotics in them?
Well, that would be a problem. You can't get probiotics in somebody who can't eat. And it's important that you do, but if you're sick enough, that's one of the prices of being sick. So that's one problem. You could use the L-glutamine intravenously. That might help some.
Well, do you think that antibiotics are overdone in the ICU? Because that usually is where people have infections.
Well, yes and no. I think when somebody's in ICU, they're usually sick, and oftentimes they have an infection that if you don't manage is going to be life-threatening. We see that all the time. So antibiotics are a necessity, but if they're given intravenously as opposed to orally, which is often the case, then that's not the same as when you take it by mouth and you interfere with the microbes that live in the intestinal tract. So when we're looking at this whole topic of what can we do to prevent illnesses or diseases that are infectious in the intensive care unit, gowns and gloves are a start that would make a big difference in terms of how many people got infections in the ICU. 40% is not a small number, and it probably would lower the risk for infection for many other things as well, particularly if we start washing our hands in addition.